Hi, it's Dr. Gary on the road with Dr. Gary, Healthcare Practice Sales LLC. Our website is dentalpracticeguide.com. And our phone number is 201-663-0935. We sell dental practices. We're dental brokers. I'm a dentist myself. And we have 7 employees now, including 2 CPA accountants, marketing director, graphic artist, copywriter, and 3 marketing acquisition people. All the information you're about to hear is for entertainment purposes only. And this is my opinion. And what we give you, it's for entertainment purposes. Speak to your professionals for advice. Okay, so today I just got off the phone with this doctor. Small practice, $200,000 growth, well, maybe $205,000. 2 operatories only, no room for expansion, ground level of some kind of professional building, but very tight office, maybe 800 square feet, and no room for more expansion. Someone was trying to sell the office before I got involved, another broker. He called me and says, come on down, try to sell it. I brought a few people there. And I've only had it for a month or 2. As you know, dental practices takes about 6 to 9 months to sell. So I brought another private buyer. It didn't work out. Another one of my private buyers called today. Now, I knew the doctor was getting anxious, and he was talking about he wants to get this done or else he's going to close down. I didn't think he would close down. So my buyer called me. I got in touch with the seller, and I said, okay, we have a hot buyer ready to go. He says, I shut it down. I closed the door. I emptied out all the equipment. It's gone. I said, well, what happened to all the charts, the records? He says, I got them. That's it. He says, we're finished. My suggestion, this is not a good way to go. First of all, you had some value of the practice, even at $200,000 gross, even if you just sold the records at 30%, just the records. Maybe we could have gotten $60,000, $70,000 for them, or maybe we could have gotten $50,000. But it's not only the money. If once you sell those records to another dentist, he then becomes the custodian of those records. He's responsible, and he gets the phone number, of course, and he'll incorporate them into his practice. But he also takes on some responsibility of the patients. The patients have a place to go. You didn't abandon the patients. I'm sure the doctor wrote a letter that he's going to be moving and all that, but he would have been far better off selling to the other dentist, getting the burden off of him, transfer all the charts, transfer the phone numbers, and that dentist that he sold to has a vested interest to make sure the practice is successful, and he'll stand behind that doctor certainly to some extent. If you abandon or just leave the practice and shut it down, those patients are going to scatter. They're going to go all over the place. And who knows where they're going to wind up or what dentist is going to say something about them. So that is a problem. It's a big problem when you think you could just shut the practice down, close it up, and all your problems are gone. Your problems are not gone. For the next 7 years, you're responsible for those records. You've got to get them to the people that are asking for them. And periodically, maybe every couple of weeks, somebody will want their records. So you've got to be to the point where you can't be at the point that you just walk away. You could walk away if you sold the practice to somebody else or sold the charts to somebody else. If the doctor came up with some number that you didn't have to work there, sometimes they'd lower it down to like 20% of the value. It's still less headaches for you. And he has the burden of, patient comes in, he'll try to please them and satisfy them. Or else now there's somebody that patient's going to scatter. So it doesn't work out as well. We never suggest just closing and shutting it down and thinking all your problems will go away. It doesn't work that way. So we're here to help you at any time. We answer the phone 24/7. We take off Christmas and Easter, and we work 363 days a year. And we have fun every day. Oh, yeah. Bye now.